Hello, everyone. Happy Wednesday. I'm Randy Murphy, epidemiologist and director of disease surveillance at the Mobile County Health Department, here on Wednesday, August 11th, to give you the update of the COVID-19 pandemic on Mobile County. I've got really good news. Our servers are back up, thanks to Tommy and David and a lot of other folks working to try to get our servers back online so that we could begin producing the daily expanded report. I have it here, and we'll give you the information on it. Then Mark Bryant, our public information officer, will send it out by email as soon as we're done and get it posted to our website. So today, August 11th, we're reporting on 54,836 COVID-19 cases that have been reported to us since the pandemic began. 676 new cases were reported yesterday. The number of cases that have died with COVID has risen to 905. We had 14 deaths reported to us yesterday. Again, not all of those died in the last 24 hours. Some of them may have died in the previous weeks, but that is still pretty surprising and troublesome, worrisome for us. We'll be looking more into those deaths to see if we can learn more about who they are, what ages they are, if they have underlying medical conditions. We know that they're overwhelmingly unvaccinated, but we'll be looking into that. Then for the cumulative number of people hospitalized with COVID, it stands at 6,860. Yesterday, there were 51 additional admissions, and yesterday there were 466 people in the hospital with COVID-19. That number, the number hospitalized, has not dipped. It has been just a steady increase, a steady daily increase for several weeks now. I don't know how much our health system can take. We are hearing of gurneys lining the corridors of ambulances, being full, waiting to offload folks who need emergency care and ambulance transport, not being able to get that, having to travel in personal vehicles in some situations, and having maybe a firefighter attend them when they finally do get to the hospital, because there's something like a 10, 12, 16, 18-hour wait in the emergency room. So it's just an extremely dire situation. You've probably seen in the press, there have been the reports of children that are on ventilators. Our system is overtaxed and overwhelmed. As we've said before, please do not go to the emergency department unless you have a need for emergency care. Please don't go to get tested for COVID. If you have a mild illness, please stay at home and get tested someplace else, or maybe go to an urgent care or make an appointment to see a physician. If you can avoid going to the emergency department, please do not go, to help the hospitals try to handle the overwhelming number of patients that they have right now with COVID-19. Just a couple of things to remind you about. The Alabama Department of Public Health on August 6th updated their quarantine and isolation guidelines for healthcare providers and non-healthcare providers. There seems to be, particularly among parents and school teachers and school officials, some misunderstanding of what it means to isolate and quarantine. So we are trying to dig up some stuff that we used last year that sort of showed several different scenarios, particularly when it applies to COVID in households. It gets very confusing. It can get very confusing and can get very lengthy. So we will post the links on our Facebook. But again, the isolation and quarantine have changed for both healthcare and non-healthcare providers. Some of the changes are, in June and May, we were saying that if you were fully vaccinated, if you were exposed, you didn't have to go home to quarantine, that you could just continue about your way. That's been modified slightly, particularly in this area where we have very high COVID transmission going on. So if you are fully vaccinated and you're around someone who has COVID, You do not need to go home for 14 days, but if you become symptomatic, of course you have to go home because now you have COVID. If you are exposed, even if you're fully vaccinated, you should wear a mask for at least 14 days everywhere you go, not just indoors, but everywhere. And we'd like for you to get tested 3 to 5 days after your last exposure. And then every 3 to 5 days through the 14-day period, because there is a lot of asymptomatic infection in people who are vaccinated, and if they're younger and vaccinated, so that we know that you can get infected, you don't have symptoms, and you might still be transmitting it to others. So again, it's just to try and use every layer of protection that we have to try to slow the pandemic down, and try to reduce the number of hospitalizations and deaths that we're seeing in the community. So just a reminder, I'm going to give you the easy story of quarantine and isolation. If you have COVID, go home for 10 days. If you are unvaccinated and you've been around someone with COVID, go home for 14 days. Did I say 14 for having COVID? I think I did. Let me start over. If you have COVID, you go home for 10 days. Okay? If you test positive for COVID, go home for 10 days since the test. Have COVID, 10 days. Exposed, 14 days preferred, with an option for discontinuing quarantine at home at 10 days as long as you're asymptomatic and continue to monitor. So that's kind of the easy part of it. Where it starts to get complicated is where you have households. Last year, when we had run-of-the-mill COVID, we would tell people, they would say, well, my mother's sick, do all the kids need to quarantine? Or the dad's sick, does the whole family have to quarantine? And we said back then, because it was normal COVID, that it really depended on how much you could separate your COVID from your no COVIDs. But with the Delta variant, you're really not able to separate. It's so highly infectious, it's so contagious, that if one person in your household has COVID right now, then just everyone else should be treated as having been exposed or having been a close contact, because it's just so contagious. So right now, what our recommendations are is if one person in your household has COVID, everyone else in the household should stay at home. So what that means is that because you're all together, you have this continual exposure, right? So let's say you're a parent of 2 and you've got 3 kids, right? A mother, a dad, and 3 kids, or any combination of that household. If the mom gets COVID, the dad and the 3 kids are considered exposed and need to stay home for 14 days past their last exposure. So if mom has to go 10 days and mom is still cooking and caring for the kids and for the dad, then the 10th day is the family's last exposure, and they all have to stay home for 14 additional days. So with Delta and it being so transmissible and most families not able to totally separate, the whole family minimum length of time is 24 days. If during that 24-day period, one of the kids or one of the dad has symptoms and tests positive for COVID, then the clock resets. Then the dad who tests positive has another 10 days, and the other children have another 24 days. And it can just keep going like that for a very long time. There were some people who had to deal with that last year, and there are many more people having to deal with it now. So if a parent has COVID, don't send your kids to school for at least 24 days. That's the minimum. Okay, let's see. There is some back to school guidance that we've reposted, and it is just sort of a guidebook, not a toolkit or a playbook, but just guidance. There is a CDC equivalent of this. It has a lot of text about quarantine and isolation in schools, and should other students be excluded from school? What about parents? So we're this whole thing about 10 days plus 14, which turns into 24 days, which could turn into 38 days. It's complex. So we're going to try to put together some calendars and a couple of scenarios to help you think through how long you need to be at home. Please do not send your children to school if they are unvaccinated and exposed. Don't send them to school if they are unvaccinated and if anybody in your household has COVID until they reach that 10 plus 14 days. I'm sure there are going to be a ton of questions about that. It is so confusing, and everyone thinks of it in their scenario, and it takes a lot to think through it. I feel really bad for people that have, single moms that have a lot of children at home, because it's putting parents in an incredibly difficult situation. All right. Again, just if you have any questions about quarantine and isolation, please refer to guidance. Ask us on Facebook. Send us an email at covid19@mchd.org. Ask us so we can help you think through these things, because it can be quite confusing. So someone from the media asking about a report of 6 children on ventilators from COVID. Do I know if there's any truth to that? If it was a primary source report, I think you can trust it. So if it was the hospital, you can probably trust that. If it was on social media, I would take that with a dose of skepticism. All right, some questions from the Press Register asking about bed capacity in mobile areas hospitals, that hearing that they're full capacity, what does the health department should suggest is the next step? Well, as I mentioned, we're trying to dissuade people from going to the emergency department unless they need emergency medical care. We are also talking to the hospitals and trying to work with hospitals and providers to increase the use of subcutaneous administration of monoclonal antibodies to treat against COVID. This is a change in the way that monoclonal antibodies are administered subcutaneously, allows for it to be done much easier in an outpatient setting, and it is very good at preventing people from requiring hospitalizations. So we're trying to get all the hospitals to build capacity to provide subcutaneous monoclonal antibodies. Most people just refer to this as the infusion, trying to get hospitals to create, improve capacity for providing infusions to try to keep people out of the hospital. And then we are having some conversations with our partners over at the Emergency Management Agency to see if there are any options for requesting federal assets to bring in licensed care providers to assist in potentially opening up, areas of the hospital that are understaffed right now, hospitals. So there are conversations ongoing to see if we can get some federal assets. We've been told it's highly unlikely since there's no longer a state declaration, and I don't know about the state of a federal declaration. So those are the things that we're trying to do. Try to get people vaccinated to protect them from requiring hospitalization if they do get COVID. Asking people to not seek care at the emergency department unless you require life-saving services. Increase the capacity for sub-Q monoclonal antibody administration to people who have COVID and are predisposed to severe illness to prevent those hospitalizations. And then again, talking to emergency management agency partners to see if it is possible to request federal assets that may be able to assist by staffing beds in hospitals and emergency departments. All right. How many children are hospitalized in Mobile County with COVID? Is RSV also a possible infection with these cases? So in general, about 5% of our hospitalizations in the last 14 days were children less than 12 years old. And yes, it is possible that because we are seeing a surge, we've seen a surge in RSV infections this summer, it's possible that that combination is making things worse for kids. And remember, last winter when we had a mask mandate and kids and parents and everybody was wearing a mask, we didn't have a flu season. We didn't have an RSV season. It was just like the lowest level of seasonal influenza. Common colds were record lows, and all that's because we were wearing masks and we were socially distancing and we weren't going to gatherings. So then when the mask mandate was lifted and people stopped wearing masks, now we're seeing RSV in the summer when we never see that in most years. So masks work. All right, at what point does an official state of emergency need to be requested for Mobile County? Clearly, if hospitals are above capacity, we're in a state of emergency. We are in a state of emergency. The fact that there is not a state or federal declaration around that doesn't affect the messages that I'm going to send you. It affects resources sometimes. It affects reimbursements. It sometimes frees up things so that we can get things done faster, easier. But it doesn't take a state of emergency for everyone to do the right thing. And that is get vaccinated, wear your mask, distance, avoid gatherings, stay at home if you're sick. All right, someone's saying at WPMI, they're looking at the data, and what they can tell is the average age of a person hospitalized in Mobile County is 53. Is that correct? I don't know what that is, the average age. I know that it's lower than it was prior, back in our previous peaks. It is low. So it is true that we have people of all ages that are hospitalized with COVID. The highest percentages are in that middle age group, so right around that, middle age. But we have 0 to 4-year-olds that are hospitalized, and we have people over the age of 75 that are hospitalized. And then another question asking about the statistics that I can't answer because I've not analyzed the data in this way. And our dashboard has been down for a couple of days. So I'll have to do some fact checking on that outside of this live broadcast. Okay, Facebook questions. Thanks for what we do. Pediatric patients hospitalized, this is a comment, our pediatric patients hospitalized are heartbreaking, but unfortunately people don't believe it and believe that they're being treated for RSV instead, which RSV is also very bad for children. Can I explain the difference, how they might interact? Just wanting people to really take it seriously. Again, RSV is it's a very serious disease for children. And I go back to the comment that I made just a few minutes ago, is that when we were wearing masks, we didn't have RSV in children or in adults. But as soon as we stopped masking, the RSV rate spiked in children and then started carrying over into adults. So RSV can be prevented, RSV transmission can be prevented in the same way that we can prevent COVID, and that is through wearing masks. And now we have even a better tool, which is getting vaccinated. I don't know about any synergistic effect of co-infection with RSV and COVID-19. I've not seen any sort of well-collected and well-compiled data on that. My hunch is that it most likely will be more severe than getting one or the other, but I don't know about that. I haven't seen any studies on co-infection in children. It is very serious. To intubate a child is a serious, life-threatening situation. And again, the only tools that we have to protect children under 12 is to surround them by a group of humans that are vaccinated, and that group of humans also wears their masks and distances themselves when they are out of their household, and send the child to school with a mask. Are the symptoms of Delta variant different? No, they are the same. Is there a specific test for the Delta variant? This is a two-part answer. To test for COVID, right? There are specific tests for Delta variant, but not every test can detect Delta variant. So there are many tests out there that just still say it's COVID or not. There are some PCR tests that will say this is COVID and it's Delta, or this is COVID and it's Alpha. And then there are some tests that you can do like a whole genome sequencing and tell specifically what sequences it is, maybe something that's not even identified yet. But it's rare that someone would be able to go to a testing facility and say, I want to get tested for the Delta variant. And you don't need to do that because 90% of what's in our county right now is Delta. So don't feel like you need, just out of an abundance of wanting to know if you have the Delta variant, you can't just say, I want to get tested for Delta. That's not how it works. We'll test you for COVID. And then if you're positive, you can pretty much just assure yourself that you have the Delta variant. So then there's an add-on question from this person who is quite curious about this. So here's what we've been doing to conduct sequencing surveillance for about the past 5-6 months. So we started randomly selecting PCR specimens from around the county and sending them to get sequenced. So that started months and months ago. So we try to do up to 100 a week. Now we've been doing, 200 or 300, but we're going to be cutting back. So what we saw was this steady progression. So 4 or 5 months ago, it was almost all UK. Some parent strain, almost all UK, 1 or 2 other, the California strain, New York strain, right? And over time, you can see every week when the percent of the 100 that we tested just kept going lower and lower for UK and higher for Delta. So by now, if you look at that same bar graph, you've got maybe 2-3% that are UK, and the other is some form of Delta. There's no parent COVID out there anymore. What happened to the Pfizer vaccine needing to be kept at super cold temperatures? Well, this one, haven't heard this one in a long time. So when the manufacturers first developed Pfizer, because it's an mRNA and messenger RNA is very delicate and can sort of fall apart or lose its sort of structure when it's not properly stored. And so in the beginning, the manufacturers were really careful about how it was stored. They wanted to keep it at ultra low and all of that. Well, since the time that they first started shipping vaccines in December, they've had 8-9 months now to examine the stability of that vaccine under different storage conditions, and that's what they've done. So, looking at how well it does if it's at -20 for a week before you thaw it and use it. Looking at it to see how long might it be stable if you store it at refrigeration, about a month. So that's what they have done, is as they learned more about this storage and handling, they have modified how it can be stored. So right now we can take a vial of Pfizer out of -80 and warm it to room temperature in a controlled environment and keep it at room temperature for about 30 days before it would have to be discarded if it was not used. All right. Something about all over-the-counter tests aren't in the daily numbers. It is true that the daily numbers that we report are the ones that reported to the state surveillance system. It is not, nor is it meant to be, a 100% catch-all result. So if you do a self-home test, some providers that are doing bedside tests, not all of those go into the statewide surveillance system. But the surveillance, again, it's not meant to be a population-based data collection. We know that we're not going to get every positive and every negative into that system. But we have goals of, we want X number of tests to be performed each week so that we can kind of ensure that the sample we're getting is helpful in looking at trends. So I would never say precisely at this point of time, X% of the population has had COVID. What we do is look at trends. Are things going up? Are things going down? How much worse are they in younger age groups than older age groups? That sort of thing. It's not a clinical trial. It's not an unbiased sample of the population like you might do in an analytic study, but it is, usually things are underreported to us, so we know there's, for the most part, a lot more disease out there than we detect, but that system is what informs our decisions, policies, everything. All right. Someone saying, how are you keeping those being tested that are negative safe from those that test positive? And this is probably referring to our clinics. I will admit that our clinics are busting at the seams right now, and it is a struggle to keep people 6 feet apart in the clinics. We do make sure that they require them to wear a mask. People who test negative or are just there to get vaccine, they go to a different part of our clinic altogether. If you come into our waiting room at Keeler, try to put people who are sick on one side of the waiting room, on the where there's a partition, and people who don't have symptoms on another side. Require them to wear a mask. Monitor those spaces to make sure they're complying. Keep them distance apart from one another. When things start getting crowded, we ask people to write their number down and wait in their car, and we'll call them when we can bring them into a less congested waiting room. So the last question is about people who have COVID that are vaccinated, able to transmit it to others, and the answer is yes, that is possible. Because again, if you're fully vaccinated, your chances of hospitalization and death are almost nil, but you still could catch COVID, and you still can be infectious to others that are vaccinated or others that are unvaccinated. It's not a dumb question, but thanks for asking. Oh no, there's one more bullet. So someone asking, when will we have tests to determine what variant someone has? We already have those tests available to us, but you cannot request a specific test. If you get tested for COVID, you get tested for COVID. The tests that that determine variants are slightly different breed. So we just want to know, do you have COVID or don't you have COVID? The prevention messages, the treatment, the what do you do now, all of that is exactly the same so far, no matter what version of COVID you have. You need to get vaccinated. You still need to quarantine and isolation. There are no changes in quarantine and isolation, whether you have Delta or Gamma or Lambda. No changes in prevention measures. Treatment is all the same. So just can't go to your doctor and say, hey, I want to get tested for XYZ. You get tested for COVID. All right. We're going to
mention Saturday and Sunday.
I would like to mention Saturday and Sunday. Oh, you're talking about at the mall. Okay. So this weekend, our mall location that's been running since Wednesday. Gosh, we're a week old already. Let's see. We're going to be open this weekend on Saturday from 10 to 6 and on Sunday from 12 to 4. Remember, it's the old Forever 21. You have to enter from the back side of the mall. You cannot enter from the interior side of the mall. And please do not go in Dillard's asking where to get tested for COVID. We're on the back side of the mall. All right. You can only get there from going from the parking lot directly to our space. So if you have been exposed to COVID or if you have symptoms of COVID, do not go into the mall. Come directly into our clinic. All right, with that, I'm going to say good day, get vaccinated, be safe. We'll talk again tomorrow.